collectively recognize that we are coming from the traditional unceded territory of the Nanaimo First Nations, and we're committed to honoring their history, culture, and ongoing presence here on First Nation land. And then to introduce Ranjeet, our presenter for today. We're very excited to have Ranjeet. He's from Creative Therapy Consulting. He's facilitating today's presentation. He's a registered kinesiologist with nearly 2 decades of supporting brain injury survivors through a variety of roles, including rehabilitation and advocacy, through his committee work as well. We're very grateful to have him here with us to explore the important link between chronic pain and brain injury. I'll pass it over to you, Ranjeet.
Great. Thank you, Ryan, and the Nanaimo Brain Injury Society for organizing the presentation today. And I've enjoyed our collaboration to get to this point, and now excited to deliver the presentation. So once again, my name is Ranjeet Hira, and I'm representing Creative Therapy Consultants, where we provide occupational therapy services in addition to kinesiology, counseling, and rehabilitation assistance services. So it's great to be here today and present to all of you. I'll be touching on brain injury and chronic pain, understanding the connection. And I have several years of experience working as Ryan mentioned, a kinesiologist, in addition to as a rehabilitation therapist, case manager, and team lead. And I'm excited to again be here today. So let's dive in. So for today's presentation, I'll be discussing acquired brain injury, the 2 types, traumatic and non-traumatic. And then the heart of the presentation will be the connection again of brain injury and chronic pain before I move into recovery strategies and the most practical aspect of the presentation, which is communication and movement and mindset strategies. And then we'll finish off with a Q&A at the end. So firstly, the first type of brain injury, acquired brain injury, is traumatic. And this is caused when the brain is subject to sudden movements, which cause the brain to bounce or twist inside the skull. This can be very impactful and very painful, of course, as the brain cells are stretched and damaged in terms of their expansion, and this causes severe discomfort, pain, and symptoms. Some examples include car accidents, sporting injuries, and falls, as the depiction of the picture. And I can actually relate to sporting injury. I had a soccer injury as I was the goalie in a sporting activity, and suffered a mild concussion. So this is a very common type of brain injury, and as a result of the types that can cause it. There are 2 types of traumatic brain injury, closed and open, both very impactful. Closed is damage which occurs without a break in the skull, whereas open is more of a penetrating injury, and an object can break through the skull and enter the brain, for example, a knife or a bullet. And as you can see that there's definitely more penetration in the open, which can cause potentially more damage. However, both are can be extremely severe and impactful to the brain. In terms of a non-traumatic brain injury, non-traumatic is more so the damage to the brain tissue, which is not caused by an external physical force, but rather through internal forces. And there's certainly some examples that I'll explore. There's the stroke where it can be either ischemic or hemorrhagic. Ischemic is more of a blockage of the blood clot, which just is a disruption to the blood flow due to the blockage. Hemorrhagic is more of a rupture of the blood vessel, and that causes the disruption of the blood flow. Another example of a non-traumatic can be through hypnoxia and anoxia. And hypnoxia is more so the partial loss of oxygen to the brain and lack of oxygen, whereas anoxia is a complete lack of oxygen to the brain. And this can occur through a near drowning or a cardiac arrest. Another example that I'll touch on is tumors, where they can cause a growing expansion and external pressure on the brain within the skull. And this pressure exerts a lot of force within, and it just puts a lot of tension towards the skull. Next, I'll touch on some classifications, and this is a very important uh, determination of the degree of severity of the brain injury. So the classifications are mild, moderate, and severe, where a mild is more so can be termed as a concussion, which involves a temporary impairment and a loss of consciousness, lasting less than 30 minutes or altered consciousness. So more so on the milder side, however, still the symptoms can be very troublesome. Moderate and severe are actually getting more recognition and characterization as chronic conditions, as the symptoms are a lot more severe and impactful in terms of their duration of pain and impact. Moderate can involve more of a longer duration or unconsciousness, and a post-traumatic amnesia. And severe can even be, furthermore, it can be even worse with a prolonged coma and significant impairment with severe and intense symptoms. Speaking of symptoms, there's the physical, cognitive, and emotional. And first, I'll speak about the physical symptoms that can result from a brain injury. Headaches can be persistent. There can be fatigue, dizziness, loss of balance, weakness, paralysis, especially in strokes, and vision problems as well as a result from damage to the occipital lobe, sorry. So the occipital lobe, if there's certain challenges or damage to that specific lobe, it can affect your vision. In addition, the sensitivity to light and sound is also another common symptom where you can have that effect of the sensitivity to those parameters. And I'll speak about some strategies and some specific strategies in terms of the sensitivity to light, of creating a more quiet, calming environment. But I'll say that for later in the presentation. And now moving towards some cognitive symptoms, and which affects more the frontal lobe. There could be some impairments with executive functioning, specifically impaired judgment, problem solving, difficulty concentrating and focusing, certainly memory loss and disorientation. And these challenges can be aided by an occupational therapist who can certainly assess and provide strategies to provide cognitive rehab. Furthermore, language difficulties are also a challenge and can be expressed through aphasia, which is difficulty expressing and communicating one's thoughts verbally, and also in comprehension, where a healthcare professional who could provide support for the language difficulties would be a speech language pathologist, and they can provide very helpful strategies. Next, I'll touch on emotional and behavioral, and there definitely can be mood swings and increased agitation and irritability from a brain injury. And furthermore, it can actually intensify into depression and anxiety, where it's very difficult to even get out of bed, or you have to realize the new state of one's life in their recovery, and that can bring about some depression. lack of motivation to get going, and also personality changes where there outbursts and there could be outbursts with their family members, challenges for foremost. So those emotional that emotional unregulation can be intensified after a brain injury. Next, I'll touch on chronic pain and exactly the connection in the heart of the presentation today, the connection between brain injury and chronic pain. So what is chronic pain? Chronic pain is pain that lasts more than 3 months and persists beyond normal healing time. It can be widespread or focused in specific areas. And you can see in this depiction in the picture, this individual is feeling that pain in their brain, and it's causing that swelling and that neuroinflammation and the redness, and that I'll touch on in a bit. But it can result from the chronic pain can result from injury, nerve damage, or just a general dysfunction in the nervous system. Okay, the next few slides will be. I hope all of you find this interesting information between the actual connection between the brain and the chronic pain. So there's neurological damage, and this I go into a little bit more specifics on the next for the next few slides. But the brain injuries can disrupt the pain processing pathways in the brain and the spinal cord. So this damage to areas specific to the thalamus, the somatosensory sensory cortex, or the brainstem can cause a central pain syndrome. And this is where the brain misinterprets normal signals as painful. This pain can be throbbing, stabbing, and very much an aching pain. And these disruption of these pathways causes the blockage and the pain. Moreover, the injuries can also affect the cranial and peripheral nerves, leading to neuropathic pain. Specifically, in this example here, I mentioned post-stroke pain. So again, the two types of ischemic and hemorrhagic, either it could be a blockage or a rupture, infect and impact the different body parts here that I've indicated. The neural pathway can affect all your nerves from your shoulder to your arm, all the way down to your lower body. Another very important effect and connection is after a brain injury, especially moderate to severe, patients may develop muscle spasticity, contractures, and postural imbalance. And specifically, I'll speak about postural imbalance as there's certainly a connection between movement and mindset. So if one is walking with a bit of a hunch, and they're having difficulty with their posture, that certainly can affect their confidence and their ability to move forward and actively engage in their activities, which can cause more pain. If they're just more depleted, their energy is low, and this movement and mindset connection can intensify the chronic pain because they're just mentally feeling low. So there's certainly ways that there's certainly an importance to focus on posture and trying to correct it as much as possible. And you can see here in the picture, the straight posture, the person is walking with a little bit more upright and confidence compared to the second picture where there's that worry and that worrisome thoughts, which can intensify the triggers of the mindset of chronic pain. Speaking of which, this is a perfect segue into that intensification of headaches and migraines, as one of the most common chronic symptoms is headaches and migraines. And this, again, in the posture connection too, it can arise from the pain in the neck muscles, in your traps, and this in your trapezius muscles leading up to your brain. So this cervicogenic headaches resulting from the neck trauma can intensify the pain in the brain and cause also post-traumatic migraines, tension headaches, as well from muscle tightness and general stress throughout your body. Next, neuroinflammation. So brain injuries can trigger a prolonged inflammatory response, and this neuroinflammation can sensitize the brain's pain receptors and can lead to chronic pain. And so that inflammation and that swelling in the brain can just make the headaches and that feeling of I'm in severe I'm brain fog. The neurons are feeling clogged, and therefore the thinking then gets impacted and everything, and it turns into a bit of a snowball effect. So this is a very important piece that after brain injury leading to more long-term pain is that neuroinflammation and swelling. Next, I'll touch on some psychological and emotional factors, as pain and mood are bidirectional. So if there is increased pain, it can affect one's mood. If your mood is feeling low, then also it can affect and intensify your pain. So this amplifies the pain perception cycle and emotional distress. And then, of course, it could even then go into more of the psychological symptoms and factors of depression, anxiety, social anxiety, post-traumatic stress disorder, all in which can then just intensify that cycle and can make it worse. This slide, I hope all of you, and this information that I'll discuss next is very interesting, and I find this super relevant to understanding brain injury and chronic pain. Normally, the brain has symptoms which dampen the pain signals, and this is called descending inhibitory pathways. So in a normal condition, the pain can dampen the pain signals and kind of that either fight or flight mechanism, right? And it can really has a more of a protective mechanism to inhibit the pain from being worse. But after a brain injury, these symptoms can become impaired, which allows the pain signals to become more intense and persistent. So when there's impairment to these pain signals, these inhibitory pathways don't have the same effect, and impairment occurs. Lastly, there's the chronic stress and sensitization. There's ongoing pain and trauma, which leads to central sensitization. And this is where the nervous symptoms becomes wound up. So even if there's a light touch or and with that hypersensitivity, that can cause pain and discomfort. And so if one is aware of this and can recognize it, then that can go a long way in terms of decreasing the pain. And so therefore, the sensitization definitely is amplified with the chronic stress. And therefore, it's that subtle, the weaknesses and not as much of a strong immune system and not enough of a strong ability to counter the pain when there's more sensitization. And I see the chat messages coming through, so I'll definitely take a look at them at the end of the presentation. So please, again, at this point in the presentation, continue to feel free to ask questions in the chat, and I'll answer them in a few minutes. So I see now moving towards some practical recovery strategies, and I think these can be very helpful and effective when we connect communication, and then I go into some movement and mindset strategies. So some recovery strategies with helping people who have suffered again a brain injury with their chronic pain. Communication is essential. So first I touch on some clear and simple language. And why? Brain injury may affect memory, processing speed, and or attention span. So it's certainly important to speak slowly and clearly, use short sentences, repeat key information as necessary, and avoid jargon and complex vocabulary that is difficult to understand. By implementing clear and simple language, it certainly can definitely have an effect of letting the individual take their time, not rush, and also completely understand and express their thoughts. Strategy number 2, which is again the perfect segue from number 1, is to be patient and allow extra time. Processing information or expressing thoughts can take that much longer. So give the person time to respond. Don't rush them. Let them express themselves completely in their own rhythm. Avoid interrupting and allow breaks, because if they feel overwhelmed or tired, it can only exacerbate their symptoms. Strategy number 3, and a very important one, focus on one topic at a time. Multitasking or switching topics can be very overstimulating and overwhelming for the patient. Certainly stick to one question or idea before moving on, and let that completely finish, and so the person can process that thought before moving on to the next idea or piece of the element of the conversation. Pausing is very effective, as this also provides support and lets the patient and survivor feel heard and seen, that they're being recognized and their needs are being met. A really important one too is using a strategy is using visual or written aids, as this can be very helpful to reinforce understanding. Using pictures, diagrams, written notes, and ensuring that the font is legible and big enough that it's easier for them to comprehend. Written instructions can be very helpful as well, but again, it's also the organization layout of your summaries in terms of simple language and an easy to read presentation. Again, as I touched on earlier about making sure the patient feels seen and heard, is acknowledging their pain without dismissing it. Chronic pain is often very invisible and can be emotionally exhausting, and of course physically exhausting as well. So it's important to validate their experience, showing empathy, and for example saying that sounds really challenging or really difficult. It show that you're showing compassion and empathy to their feelings. Avoiding minimization or fixing their pain, such as saying if you say, oh, it can't be that bad, or you just need to stay positive. This can only minimize their pain, and it can turn into a bit of a patronization. Rather than trying to fix their pain and to form that solution, it's better again to validate their experiences and to ensure, okay, they're being heard, they're being seen, and their feelings and needs are being met. As we know as well through the cognitive challenges after a brain injury, memory and concentration can be impaired. Confirming understanding for both parties is very important for clear communication, and again, gives the patient and survivor, in addition to caregivers and family members, that idea of momentum and progressive recovery, and that everyone is on the same page. Can I repeat anything? Does this make sense? This just amplifies and supports the patient's understanding and the family members, as they're also trying to support their loved ones as well. Check that they understood and repeat back anything if needed, as that repetition is also a very clear communication strategy. So everyone is on the same page and is on the same wavelength with moving forward and understanding what was discussed. Number 7, and I touched on this a little bit in terms of the cognitive symptoms of sensitivity to light and sound. So creating a calm and comfortable environment goes a long way in terms of making sure the patient and family members, if there's a group session, feel comfortable. Noise, lights, interruptions can worsen the pain and disorientation, in addition to their confusion. Choosing a quiet, non-distracting setting is very important and crucial for a productive session while you're working and providing support to a brain injury survivor. minimizing background noise and bright lights, or even offering non-prescription sunglasses if the lights cannot be altered, can definitely help the person's the brain injury survivor's condition, attention, and ability to concentrate in the session. And this next one is is very integral to the one's recovery as well. Being consistent, being predictable, routines and predictability can reduce stress and the mental load. Providing structure to your when you're working with the survivor is very, very helpful in terms of, okay, this is my checklist, this is my daily routine. Progressively, I can add a little bit more, but I'm going to have a written routine or just a general, simple schedule to follow, and this can create momentum and positivity. Regular check-in times and communicating in similar ways that the person feels most comfortable in communicating, and asking them, what's the best method that works for you in terms of communication? Next, involving the survivors and their caregivers in the decisions, but specifically, of course, the client. If again they're feeling heard and in control, it can ease their emotional pain, and that can help with their ability to concentrate and reduce their frustration. Asking their preferences: is this the right time, or would you like to talk later? In reinforcing and encouraging self-advocacy. What's working for you today? That only amplifies, oh, this is a positive of my day. I can either write it down, or it's just verbalizing it. Really, again, amplifies their confidence, and it really reinforces and emphasizes their own recovery. That self-empowerment goes a long way. And also general awareness of this number 10 before we move on to movement and mindset. Watching for nonverbal cues is super important of how you interact with your clients and provide support. If they're in pain, they may grimace, shift uncomfortably, or stop speaking. If their communication is difficult for them to verbalize, other options could be nodding, shaking your head, pointing, or using yes/no cards. This is an opportunity for them to just acknowledge without having to also exert a high amount of energy if verbalizing in that specific day takes a lot of energy out of them. So these are all helpful strategies. And we're also just asking them on a scale of 1 to 10, how are you feeling today? And again, if they're having challenges with their energy and it takes a lot of energy for them to speak, these nonverbal cues, they can write it down on a scale of 1 to 10. And this can provide alternative strategies and cues to know how your patients are feeling and how they're interacting and feeling on that specific day. Excellent. So now we'll move on to some recovery strategies specific to movement and mindset. So as a kinesiologist, I'm very much working with clients on their movement, and then also, again, helping in their brain injury recovery. So this connection between movement, using a kinetic frame of mind in terms of reactivating their neurons and their ability to function and be productive, and how that relates to mindset and the brain in terms of the cognitive effects is very interesting and very connecting, very insightful of how the connection can be helpful in one's recovery. So first I'll touch on movement. As you can see here, I have a couple of pictures of vacuuming and washing the dishes. Small repetitive tasks, such as reaching and bending, can be a stellar opportunity to reactivate muscles, in addition to one feeling productive and helping with completing activities of daily living. So these small tasks, whether again just be scrubbing a pot or a pan, or vacuuming in gentle movements creates incremental movement where it's not a rigorous or vigorous exercise program right off the bat. And this also it provides an opportunity for progression without the exercises being too difficult or potentially a setback. Because again, if you put a client on a program, an exercise program, after a brain injury, depending on the severity, it might be too much too soon. So these go a little bit under the radar, these kind of activities, and it just creates abilities of I can still function and do things within my home and small tasks that are not as intense. There are specific individual and group programs, and one I'll speak of which specifically is the sales program. This is a home-based program of 7 basic exercises that are not as complex as some more advanced exercises. Standing on one leg, high stepping sideways, a forward lunge while using the counter for support. These can be subtle activities, and again, they can be also used between breaks while you're washing the dishes to remain loose and active and keeping your muscles stretched and flexible. And I'll also, before I move on to the next slide, you can see there it's I put on sit to stand. And a very effective, simple exercise, but make sure you're not coming up too soon from the chair. Sit to stand is excellent because you're rising, but rise slowly after a brain injury, not trying to avoid jerky movements. And that sit to stand movement is a great, very simple exercise. Furthermore, then in time and with progression, then a creation of an exercise program can result. A kinesiologist can develop a specific exercise program, which of course provides several mental benefits: increased energy, a decrease in the severity of symptoms, of cognitive fog, disorientation, and generally that enhanced focus, which again is which I'll speak about shortly, is that connection to the mindset. It really improves an ability for enhanced focus. But I emphasize, start slowly and gradually. Increase the exercise parameters in a very incremental fashion. This will elevate their endurance in a gradual manner rather than doing too much too soon. Group exercise programs are excellent. Seated, chair, focusing on the lower body, where you can do basic leg extensions, just simple body weight movements in a group program, in a group exercise format is excellent, focusing on balance and stability. But there's also non-seated, where you could make sure you're at the wall and also just doing some general standing exercises, some hip movements, all excellent programs. So again, seated or non-seated, both are really good. All while during this time, good nutrition and sleep is crucial for increased energy and participation. Getting again, back to routine. So I'm kind of drawing on all the points that I've already addressed, but maintaining a good routine with eating well and good sleep hygiene, going to bed at the same time, waking up at the same time, ensuring you have enough rest and recovery after a brain injury, and with the connection again to, of course, to chronic pain, that can only help with reducing one's symptoms and decreasing the chronic pain when you have, of course, sufficient rest. Next, I'll move on to mindset. So now we can see that with the movement, there's going to be, of course, an outlet of energy expended. So conserving and pacing one's energy is super important. Inserting breaks into a patient's schedule with strategies of calming activities is very effective, because their day-to-day tasks of appointments and other general tasks, household tasks, those day-to-day tasks will always be there. But inserting calming activities can draw a good balance of pacing the ability to manage and complete the day-to-day tasks. It also builds endurance. So visual schedule of tasks, like with a written calendar, can be very helpful. So that visual reminder and seeing it is very effective as well. So some examples of calming activities and are include deep breathing, yoga and stretching, walking, journaling, and as you can see, the list goes on. But I would like to touch on the last point of expressing gratitude. Trying to reinforce and empower your clients and giving them support by reinforcing the importance of expressing gratitude goes a long way. Recently, I came across a strategy of for 21 days straight, try to write down 3 things that you're grateful for. This builds momentum and tries to take the survivor away from the victim mindset, because then the more of what you're grateful for and what you have in your life can only, again, increase one's energy and focus on the positive rather than the negative. Next, memory. If you put a visual reminder on your fridge using a calendar or using your phone for reminders of appointments, this can help with memory, and these are excellent strategies so you don't forget things. And it can also, as you can see with the check marks, that feeling of being productive and building confidence and restoring the ability to get things done is a visual reminder and reinforces that ability to function and do things in a good way and getting more out of your day. But again, incremental, because if you put too many things too soon after a brain injury and they're experiencing chronic pain, it can feel too much. So why not one at a time, little by little, increase that list to get things done and that visual reminder in case they forget. Next, I'll speak about an excellent program through Pain BC and Pain Canada called the Empowered Relief Program. And they have a framework called and a component of their program about reframing thoughts. And it's shifting the negative thought patterns to positive reframes. For example, my head is always hurting. It's never going to get better. And the person's not feeling good. They're feeling down. It's chronic. It's always going to hurt. A helpful reframe is being a little bit more detailed and saying, with the right pacing and rest breaks, it will get better. It will improve. So this reframe, again, shifts the mindset into more of, I can complete the activity and I can, and I can attitude rather than depleting of energy and a negative mindset. Also, everyone's different. So a self-soothing action list is very helpful as it's a go-to reference of a grounding and calming activities to reduce one's stress and anxiety. So whichever the calming activities, again, that I touched on in a previous slide, that self-soothing action list can be an excellent reference to help one in their recovery. And I'll finish with a few mindfulness techniques. So you're welcome to try this in the moment right now or after the presentation, but they're called finger breaths. Okay. So if you look here, it's about just being that mindfulness and being grounding techniques to come back in the moment if your thoughts are scattered. Okay. So you're going to just trace each finger with an inhale and then an exhale coming down the finger. And you can complete that. And it just is an excellent ability to do finger breaths as an ability to calm when you're feeling a higher level of anxiety or stress, and the pain is intensifying and in the brain and in generally affecting all the other areas of your body, but mainly, of course, you're feeling the headaches, tension, migraines. Coming down, drawing on this technique of finger breaths can be very helpful. Another excellent technique is box breathing. And it's taking a deep breath, inhaling to a count of 4. And as you can see from the slide, the box and the picture there, inhaling for a count of 4, holding for 4, exhaling for 4, and then holding your breath again for 4. So this is also not super slow either, because then that'll be difficult to hold your breath for even an even, well spread out 4 seconds. So don't have to hold for too long, but just a simple count of 4 of inhale, hold, exhale, hold is also a very good technique to help with breathing and calming and coming back into an excellent mindfulness state. And lastly, this technique here of the 5, 4, 3, 2, 1 technique of in your surroundings, 5 things, recognizing 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. There's also a very, I think, an eloquent and very simple way to put that to finish the presentation today in terms of this information on this slide. Mental wellness is your ability to be in the moment. So if you can be as in the moment as possible, because that's the moment is all we have. The next moment, the subsequent moment, that is a state of mental wellness in itself. That you're ensuring your mental wellness by doing your best to being in the moment. So this technique helps ground the survivor and can help reduce pain by just getting back in the moment without the thoughts, the racing thoughts, and which exacerbates the symptoms. So this is a very, very good technique. So I'd like to thank all of you for coming today and being here. And I appreciate your attendance. And I look forward to the questions in the Q&A. And Happy New Year.
Hi, thanks so much, Ranjeet.
You're most welcome, Ryan. It was great to present.
And yeah, I'll open it up to people to raise their hand, and I will come around and unmute you.
Hello, can I be heard?
You
Yes.
can, yeah.
Hello, thank you. I have a question here about whether or not you've treated patients for pain as functional neurological syndrome, which were having convulsions or not.
Well, that's a great question. And I appreciate that question because with my experience of working with brain injury survivors and how they've had their complex conditions, yes, I have. And this is the behavioral outbursts where there's some seizures, convulsions of whether it be in a community setting. I can draw from one example. It was in a pool setting, and I can touch on some strategies that worked. It was a physical session in a pool, a swimming pool, and the client had physical ailments and suffered a brain injury. So the best way, of course, is to ensure his safety. When in the pool, there were some outbursts and convulsions resulting from his pain and his injury. The best approach that I took, again, because he wanted his space and a feeling of empowerment and so forth, was to, of course, to ensure his safety, but within the pool, providing a sufficient space, but not being too far away from him either, of like not to the other side of the pool, but enough space for him to feel that he can control his symptoms as much on his own in terms of because if I were to get too close to him, and he may see it as a form of restraint, and that could actually make it even that much worse. So it just draws on the importance of getting to know your patients. And it didn't turn into an emergency. Of course, then I would have called 911 or an ambulance. But at that moment, it was just more providing a sufficient space for him to kind of breathe and using the grounding techniques through it so he can just calm himself down and feel better. So with hemorrhage, yeah. So that type of stroke and opioids, those medications could, that opioids could help, but I think that's very important to, in terms of their family doctor or who has, the treating physician who has prescribed the opioids. I think that's important in itself because it's just a matter of pain management and the appropriate dosage of the opioids and how they're helping, whether it's a tailored approach to reducing because of the different side effects. I think it's important to ensure that the medication is hopefully minimized, or the opioids, it's not so much of a support or no, I wouldn't say crutch, but it's not too much of a reliance on the opioids where they can actually manage and have more less reliance on them to recover.
It sounds like it is quite a case by case.
Yeah, and it touches on it definitely case by case, Ryan, and it also touches on the importance of an interdisciplinary team, because if you have a multi-allied healthcare professional team, that really helps because then you have the different specialties, whether there's a physician, there's an occupational therapist, a PT, a kinesiologist, a rehabilitation assistant, a case manager overseeing the file. And then one comes into these care conferences and they can touch on their different specialties, which can be very helpful in the recovery.
There. We have a couple more questions here. Leah.
Yeah.
Forgive me if I perhaps maybe misunderstood you. I have a minor traumatic brain injury from a car accident. It's been over 5 years. I'm curious, since I believe you'd mentioned that mild traumatic brain injuries tend to resolve quicker. I struggle with chronic pain and concussion symptoms and have been told I now have post-concussion syndrome since my symptoms didn't resolve themselves. I'm curious if you know a bit about this and could touch on it a bit if you do. Mostly I'm curious about why this happens.
Oh, for sure. And certainly, maybe just to clarify, mild, not necessarily is the recovery faster compared to moderate and severe. It is a very much a case by case case by case, and every situation varies. So just to clarify, certainly the symptoms can be still very chronic or long lasting if it's a mild traumatic brain injury. If it's continued on, in terms of, like you said, post-concussive syndrome and it's taking a longer recovery, it just depends on the deficits that you're having and what's the best way we can help address those challenges, whether it be cognitive, physical, those speech, and then the appropriate healthcare provider to help you. So if you can give me a little bit more information of your situation, that'd be great. But I think it's just putting the right people in place to help you. I hope Leila, are you there, Leah? I think did she step? She's on mute, I think, Ryan. I don't know.
Yeah, I think here I'll one moment.
Yeah,
I will fix this shortly.
no problem. Just so I helped answer her question
Yeah.
because
Just
again, that's about making sure the patient, the client, the survivor is being seen and heard, to ensure that they're what they're feeling and experiencing and the challenges they're experiencing, we can help support them in terms of it can be a post-concussive syndrome, and those symptoms can be very much long lasting.
Oh, for sure. Sorry, I was unmute. I was on mute, but I could not unmute myself.
Oh,
sorry,
okay.
yeah.
Yeah,
No,
I'm just
that's
trying to
okay.
control we have quite a few people in the presentation, so I'm just trying to
No,
manage. Thanks,
that's
Leah.
that's perfectly okay. I just yeah, couldn't do anything about it. Um,
yeah,
in terms of symptoms, mine are a lot of like I have a whole host of symptoms, but I have a really good team of especially because I have a lot of visual symptoms. So I see an optometrist that really is helpful, and a chiropractor that helps me with the physical symptoms.
right.
I'm always trying to find more people to add to my team, and I've pretty much tried everything. I've seen almost everyone in Nanaimo that I could get my hands on, so um, I'm
Yeah.
constantly.
Oh, I'm happy to hear. Look how specific you mentioned chiropractic and a chiropractor and optometrist or ophthalmologist, if I'm not mistaken. And so I think that's really that's excellent because those specific professionals can provide plenty of support, and I hope they are for you. With the occipital lobe damage or the blurred vision or ophthalmologist, it's very specific to the case. Or for your physical symptoms, a chiro, very good. So uh, you know as much support I can give you from afar. Stay positive, keep at the strategies and the effect, and hopefully the strategies I provided today can also help.
Absolutely. Thank you so much.
Yeah, my pleasure.
Uh, so there are a few other questions. I'll let Heidi go ahead and ask hers.
I know our brains are amazingly uh I can't think of the word, but like neuroadaptive. So it's been about 14 years since my car accident, and I've done many different things to help with the pain and a lot of the things you mentioned, vision issues and all those things. Um, but is there a point at which it's been too long since the injury to hope for any significant improvements?
Oh, that's a great question. Significant might be the key word there, but I don't. I'm a big believer of recovery, and I know there, sometimes this injury is very severe, where also reality kicks in of sometimes after a brain injury or the type of accident, one could be in a vegetative state, and that's very devastating. But uh, depending on the significance of the severity of the symptoms, I think that there still could be very much. I wouldn't lose hope. For any small progress or small progressive steps that one can take, it can be even if it's very small baby steps, and it's taken a long time to even get to that first baby step. Don't give up. Like, there's always their approach. There's always support out there. There's this, Nanaimo Brain Injury Society, excellent organization, plenty other local brain injury organizations that can provide support across the province and across the country. So, I wouldn't lose hope. I just think that sometimes it needs to be tailored or altered, or a different approach, or a different professional, or a different depending again on the deficits, on a specific approach that can help with the recovery. But please don't lose hope.
Thank you. Thank you so much.
Yeah. My pleasure.
I have another one here from Pamela. She says, how do you encourage a client to learn self-management or pain education without it being interpreted as it's all in their head, which is sometimes how they feel it comes off.
All in their head. Okay, so that it's that they're not able.
It sounds like they're a practitioner and they're saying, how do you help somebody with self-management without it coming across as them thinking we're telling them it's just all in your head. You can control it by your thoughts or your own self-management. Um, how do we promote that without it coming across like we're saying it's just all in your head?
Okay, I understand. Yeah, I think again, I'm going to draw it to this to one of my slides on reframing thoughts of that negative to the positive shift. So it's not it's supporting that reframe. So it's actually empowering you. So it's just not all in your head. So you are self-managing it, and you want that advocacy and that independence, right? Because from a recovery, you want to get back to as much as possible to what you're able to do before the injury. So if it's all in your head and that it's that self-management of I'm the one mitigating this, yes, you have your support, but as much as you can reframe your thought patterns so it's a positive reframe in your mind and your brain, that can be productive rather than all in your head and it's I'm the practice. I don't know what to do. I'm suffering. I'm hurting. I'm feeling down in the dumps. Why not empower your own mind and brain and using a positive reframe and writing it down, and you can visualize the positive reframe. And again, it's all coming. This is again a very much an excellent program about training your brain away from pain. So if it's all in your head and training your brain away from the pain, this shift in reframing your thoughts is underrated. It can be very helpful.
And I'm going to let Salome here through with another question.
Hi.
Nice.
I'm okay. Oh wow. Okay, I don't even know where to start, but I really appreciate this program. Um, and I had a brain injury 4 years ago. I actually maybe five. I had it in December of 2021, so I'm not entirely sure if that's 4 or 5 years right now. I can't math really well. I don't care. But um, I've been to occupational therapy. I've been to vestibular therapy. I went to neurovisual therapy. I still go to a chiropractor. I go to, oh man, physiotherapy, massage therapy. I do everything I can. Um, I kind of got to a point where I stalled out and I kind of I struggle with some things still, math and numbers, really hard still.
Mhm.
Pain is a huge thing for me. Um, I had a back surgery in 98 and then another one in 2001. I had to learn to walk, all kinds of stuff, but my back still hurts. And when I fell and hit the back of my head, but it felt like I got punched out. My face hurt more than the back of my head, but my neck and my shoulder and a whole bunch of stuff got ripped and hurt. Um, but the pain is worse when I'm not in control, like when I'm anxious, when I'm all that sort of things, right?
Right.
So I really appreciated that slide that had the 5 4 3 2 1 thing on it because I I knew that about
Yeah.
100 years ago, but don't remember it,
Right.
right? I use a lot of meditation, a lot of stuff. Um, my work kind of gave up on me, and I'm not going to be able to go back there. Um, they pay me a full-time wage to stay home because I used to work in a hospital and I'm dangerous now because I can't do things that I used to be able to do. But I volunteer and I talk to people that have brain injuries, and that helps me, and I'm sure it helps them. And I know a lot of us on here do that. I don't know that I, I had a question. I'm getting there, but I don't know what it is anymore.
No,
But
take your time. Take your time.
yeah. So, and then somebody said something about the pain being all in your head. And I've gone through a lot of classes and a lot of stuff. I get nerve ablations where they burn the nerve so it doesn't hurt me. Like, um, and you can breathe and talk yourself out of pain, but there's sometimes when you're so deep in it until you have almost, I don't know what to say, a crutch or something to just to 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 kind of melt it so that you can get on a good diet and get on an exercise program and just sort of calm your nervous system down so that you're not fighting the pain, I think.
Right,
And then because I had to fight and I got my doctor to give me a pain medication, um, but not because I wanted to be on it forever, because I wanted to get my shit together,
right,
right? So sometimes does pain medication can help, I think, as long as it's a part of the plan and not a part of the long-term plan,
right.
right?
Yeah,
So is
yeah.
that valid?
Yeah, so there, I like how you kind of that, we also touched on the question earlier about the pain and the medications and the opioids as well. So it definitely connects. So I agree.
I found out it doesn't, sorry, I'm so sorry for interrupting. Can I say
Yeah,
something?
go ahead, go ahead.
Okay. Um, I went to a pain clinic apart from my doctor because he didn't want to help me too much. And
Yeah,
I talked to that lady and she told me there's also opioid alternatives. Um, um, and knowing that that's out there
right.
helps me, like just knowing I can go, okay, somebody will help me if I can't take care of it myself. Just
Yeah.
knowing that is empowering and helps you to fight through the pain. So sorry about and yeah.
No, no problem at all. I want you to feel again, emphasizing seen and heard, and to I have all the patience in the world. So please don't apologize. No, no apology necessary. Uh, Back to your question there, right at the end there, and I have short-term plan of medication, but then the usefulness for the long term. I do. I am a proponent and of it can certainly help in the short term, and not to say that, but if it is turns, it is chronic. There's several cases where people are on medications for a long period of time to help with the pain, the headaches, the migraines, again, depending on the severity. However, there's comes, of course, plenty of side effects with pain, with medication. So and so for that per se, I am a supporter of long-term reliance on medication if it can be there, if the dosage can be reduced, and ultimately, hopefully, one day. Not saying it's necessarily it has to be, because of course it provides support and medication can help, but
Hmm.
that long term reliance with that, it's nice if you if with the recovery by gradually decreasing the dosage to ultimately, hopefully, one day not having to rely on medication. I think that's the best case scenario, because of the potential side effects, and just leaving letting your own immune system and your own body adapt to,
Learn again.
yeah, adapt, and different, seasons of weather, even, in the winter, chronic pain can become, can feel worse, or can feel amplified. So letting your body react and recover in its own way through the physical recovery, the cognitive and movement and mindset piece, that I'm passionate about, in terms of that connection. So certainly over time, it would be, I think, more ideal if there's a decrease in the medication.
Hmm. Yeah, I wouldn't want to be on medication for a long time.
No, no. I just think it actually depletes the body's ability to adapt and react. But
Yeah,
short term, sure, I think it definitely can help. But then, hopefully it doesn't become too long lasting.
yeah. Well, I take supplements now, and that makes a huge difference as well.
Yeah, supplements are really good too, for sure. Absolutely. Yeah. Depending on, yeah. Well, then thanks for sharing. And I appreciate your openness.
Thank you.
Yeah, thank you everyone for joining us today, and thank you for your questions. And I want to say thank you one more time to Ranjeet for putting this on for us.
You're most welcome, and thank you again for everyone who attended. And Ryan, thanks for organizing again.
Of
Mm.
course.
Okay,
Okay, and bye for now. We'll see you again soon.
take care.